Outcome 6. Health, mental health and well-being. We share the long-term goal for health, mental health and well-being set out in the BSL National Plan, which is: BSL users will have access to the information and services they need to live active, healthy lives and to make informed choices at every stage of their lives. By 2024, the actions we will take are: Reference 6.1. Actions. A full system review of BSL communication supports for patients and service users will be carried out and the findings implemented. Measure. Number of individuals utilising new systems of working. Uptake from individuals completing registration forms to use systems of working. Reduction in the number of complaints made about BSL provision. Reduction in the number of concerns raised about BSL provision. Increase in the number of compliments about BSL provision. Accountability. June 2018 to March 2019. NHS Fife Equality and Human Rights Strategy Group. NHS Fife Board. Fife's Health and Social Care Partnership. Reference 6.2. Actions. NHS Fife will ensure that once the review of communication supports is complete, then work will commence to raise awareness of BSL language, with a focus on public awareness messages, staff training. Measure. Number of public awareness messages issued raising awareness of BSL. Number of staff who attend training and outcomes reported. Accountability. March 2019 to September 2020. NHS Fife Equality and Human Rights Strategy Group. NHS Fife Board. Fife's Health and Social Care Partnership. Reference 6.3. Actions. A statement about access to communication support for all sensory impairments to be included in organisational policies and procedures. Measure. Number of patient service user related policies that includes the statement. Accountability. May 2018 to December 2018. NHS Fife, Fife Health and Social Care Partnership, Clinical Governance Group, HR Policy Group, General Policy Group. Reference 6.4. Actions. NHS Fife Interpreting and Translation Service and Deaf Communication Service will promote Contact Scotland to BSL users and also raise awareness of the service with partners. Measure. Number of individuals using service and number of leaflets distributed. Accountability. May 2018 to December 2018. NHS Fife Equality and Human Rights Team. Fife's Health and Social Care Partnership. Deaf Communication Service. Reference 6.5. Actions. NHS Fife will distribute the nationally developed NHS Inform communication support cards for people throughout its networks. Measure. Number of cards distributed. Accountability. June 2018 onwards. NHS Fife Equality and Human Rights Team. Reference 6.6. Actions. Access to psychological mental health online resources will be increased. Measure. Number of times the online BSL resources are used. Accountability. NHS Fife Psychology Services and NHS Fife Equality and Human Rights Team. Reference 6.7. Actions. Ensure that BSL users and health and social care staff are aware that hands-on interpreters can be booked for health appointments. Measure. Number increases in the number of times this request is made when booking appointments. Accountability. NHS Fife Equality and Human Rights Team. Deaf Communication Service. Reference 6.8. Actions. Ensure the formal complaints procedure for NHS Fife and Fife Council is available in a BSL format. Measure. Completion of the BSL video clip. Accountability. NHS Fife Equality and Human Rights Team. Deaf Communication Service. Reference 6.9. Actions. Deaf community to work with NHS and Fife's health and social care services to explore ways that ensures that deaf people waiting on appointments do not miss the appointment if it is announced. Measure. Working group established to progress and measure. Accountability. Deaf community reps, NHS Fife, Fife's Health and Social Care Partnership. Reference 6.10. Actions. Ensure all frontline staff and health and social care staff have the opportunity to attend deaf awareness training or enhanced training. Measure. Number of staff attending training sessions and reported outcomes from training. Accountability. NHS Fife Equality and Human Rights Team. Deaf Communication Service. Reference 6.11. Actions. Signpost BSL users to health and social care information available in BSL to be produced by NHS Health Scotland and NHS 24, and develop complementary information in BSL about local provision as appropriate. Measure. Feedback from BSL users. Accountability. NHS Fife Equality and Human Rights Team. Deaf Communication Service. Reference 6.12. Actions. Work with BSL users to develop information in BSL about local health and social care provision. Measure. Range of information available in BSL. Accountability. Deaf Communication Service. Reference 6.13. Actions. Signpost BSL users to health and social care information available in BSL through internal systems and wider use of social media. Measure. Feedback from BSL users. Accountability. Deaf Communication Service. Reference 6.14. Actions. Through integration boards, ensure that psychological therapies can be offered on a fair and equal basis to BSL users. Measure. Feedback from BSL users. Accountability. Deaf Communication Service. Reference 6.15. Actions. Take steps to improve access to information about sport and to local sports facilities and sporting opportunities. Measure. Feedback from BSL users. Accountability. Deaf Communication Service. Reference 6.16. Actions. Ensure that any local work to tackle social isolation explicitly considers the needs of BSL users. Measure. Feedback from BSL users. Accountability. Deaf Communication Service. Reference 6.17. Actions. Increase awareness on how to access the range of communication support available through the Deaf Communication Service. Measure. Feedback from BSL users. Accountability. Deaf Communication Service. Reference 6.18. Actions. Support health and social care staff to access available training in BSL and deaf culture. Measure. Feedback from BSL users. Accountability. Deaf Communication Service. Reference 6.19. Actions. Raise awareness of the Contact Scotland online interpreter service. Measure. Feedback from BSL users. Accountability. Deaf Communication Service.